to be here today, and warm welcome and namaste to everybody who is there today. For all the viewers of Baby Chakra and my friends, my family members, and all my patients out here, a warm, very welcome and good afternoon. And I'll make sure that today is going to be a wonderful session for all of you. A very insightful, and let's make it happen today. Happy Republic Day to each and every one today, and let's get started. So please start sharing the screen. Yes. The next screen. So today our topic, can we go to the next screen, please? Okay, there's some, can we go to the next screen, please? Next slide, please. Okay. The second, there's some, okay, fine. I will be sharing the screen to you. And okay. So the topic for today is the dental care tips during the COVID pandemic. Okay. So, there is so many challenges during the pandemic time that everybody is going through, including each and every person in this world, right? So I'm going to throw a limelight onto the dental care tips, and I'll make sure that the today's session is going to be awesome, right? So what did we discuss today? So for all the people, so there are many surge, like trending topics during the COVID times, like day in and day out, we have our patients coming down to us and saying, so about the mask mouth, right? And second is the dental care tip for the pregnant women. What are the things which we are seeing day in and day out in our clinic? And there's a surge in the caries, like cavities. बहुत सारे दांतों का पेशेंट बच्चे लोग का दांत are getting decayed. And how do you prevent that at home itself, right? And the most interesting topic is, how do you have your desired baby? How can you plan out your uh, the milestone of pregnancy and enjoy your pregnancy by having vision boards? It's a very interesting topic, and I'll make it much more interesting for all the pregnant women listening here. And along with that, we'll have a dose of humor and fun and everything. So are you ready, all of you? Okay? Yes, I can see you're ready, and I'm going to get started. Okay? So before going ahead, I would like to introduce myself. This is Dr. Mahalaksshmi here. I'm a dental surgeon and a mother of a proud son and a mind power coach. So I'm an owner and CEO of the studio, which is located in Virar West in Mumbai. So I'm a dental cosmetologist and implantologist. I have pursued my higher education from Mumbai and Canada, Toronto. With more than a decade of clinical experience, we've been helping thousands of people relieve the dental problems as well as getting smiles on their faces. Along with that, I have acquired the knowledge of mind techniques and tools during my journey of pregnancy. Why I would say this, I felt very happy when, I got a call from Baby Chakra, because I wanted to share something very important during, for the pregnant women, especially because I have done something new during my pregnancy, which led to giving birth to a wonderful soul, right? So I'll share with you some techniques through which you can also give birth to a wonderful, happy, healthy baby and prosperous baby, and make your journey of pregnancy a wonderful day. All right, wonderful time. We've been helping out with the help of Rise Academy and my international coach, Mr. Sunil Parekh, and Rise Academy. We'll be helping out. Many people can come out of any problem and live their life to the fullest. So these are my contact numbers, and you can check in through the Baby Chakra app and get through the Facebook, Insta, and YouTube Live, and you can follow us over there, right? Baby Chakra app is it's a one-stop solution for all the parents or pregnant women, or the people who want to be pregnant and give birth to the kids, and for the kids as well. They are throwing a lot of information. I've been seeing their works. They're doing very wonderful, and I think you should be downloading the app. So these are my patients, our patients. This is what we do day in and day out, every single day, to get the smiles on the patients' faces. get them relieved of their stress, get them relieved of their dental problems, and give them that beautiful smile. So this is My Dentist Studio. I'm the owner and CEO of My Dentist Studio. We are based in Virar West, Mumbai, and you can connect to the contact numbers which are given. So we have a two-floor clinic. These are my dental chairs, and we have an in-house scanning center which is available, so we can give the right diagnosis and give the right treatment for all our patients, right? So so this is about us and our dental clinic, about my introduction, right? So let's get started into the topics. Okay. So for everybody out here, for all the people, knowingly or unknowingly, because of wearing the mask every single day, so people are, or our patients are coming down and asking us, so doctor, we are having bad breath inside the mouth and we are having stinky smell hota hai. I don't know it is there now during the COVID times. ये mask पहनने की वजह से होता है क्या? So yes, it is because of that. I wouldn't say it is because of that. I'll tell you the science and how do you prevent that. Let me come back to the light so that I can just present my screen. So what we are doing here is screen. What is happening with the mask is now when you're wearing the mask, the air pass out nahi ho raha, right? When the air is getting blocked in the mouth. So what's happening is abhi aapka mask ke wajah se air is getting blocked and there is no circulation of the air. So as you all know, saliva, जो natural लार जो रहता है, that is a mouthwash. That is a natural mouthwash. It has natural defense mechanism. It clears out the debris, everything. But because of wearing the mask or low water intake, what is happening here is the saliva content is reducing. Okay, this is causing dry mouth. आप देखते होंगे your mouth is getting dried up. Okay, so because of that, mouth में आपका this people are producing out with symptoms like this, where a little swellings and decay, बहुत सारा दांत सब पूरा सड़ जाते हैं and people are ended up having swellings also, knowingly or unknowingly, right? So few people are presenting with this situation with all the gums swollen up, teeth and all these things, and they complain and they say that doctor, this was not there before. Okay, this is just because during the pandemic se hi zyada बढ़ गया. All right, so I always say that oral health is overall health. Okay, I repeat this, oral health is overall health. Why do I say that? So you start your day in the morning with brushing the tooth. You start your day with eating the food. It's all going through the mouth, right? It's the start of your body, I should say. It's just like an engine, right? So you start your mouth and then it goes inside your body, and that's how it goes inside your entire body. That's the reason why I say oral health is overall health. So now what's the solution, doctor? People come and ask me, so should we remove the mask? Doctor, so the एक और patient थे हमारे, he was asking me, so doctor, we shouldn't wear the mask, right? So I said, no, this is the protection that you have to do right now. This is the one which is going to save our lives for future from the COVID. You can never ever do, remove the mask. And I'll tell you simple techniques through which you can avoid the stink, you can avoid this mask mouth, right? Focus on your oral hygiene. Oral hygiene is very, very important. Why do I say this? So, हम लोग खाते हैं 2 से 3 बार या 4 बार, but brushing कितने बार करते हैं? एक बार? Or sometimes, only once, or that too just 1 minute or something. Try to brush for 2 minutes twice daily. This will sort out most of the problems. Okay? I would say, like, along with the home care regimes, tongue cleaning is much, much important. तो आप tongue के ऊपर भी salivary glands रहते हैं, and you have to clean your tongue and scrape out your tongue. Much, much, very much important thing. Okay? Then a mouthwash. Use the diluted mouthwash. So actually there are different brands of mouthwashes which are available, but there are different types of mouthwashes also. Cosmetic, antiseptic, antibacterial. There are different types of mouthwashes. If you have to know a deeper session about this, maybe we'll have another session next time, or you can follow my YouTube link as well to know more about which mouthwash is right for you. Okay? Then you can have this flossing. It's a thin thread which is available. ये thread जो है, you are just gonna clean in between the teeth. Okay, that way the tooth has 4 surfaces. 4 दिशा है, 4 surfaces है. So when you are brushing only outside and inside, few people don't even brush the inner surfaces of the teeth. Okay, try to make it a point that you brush the inner surface of your teeth, and the interdental surfaces, that is the sides in between the tooth, are also quite very important. वो आपके brush नहीं कर सकता है. You have to use the floss. Second is you're treating your gum diseases, and then watch on your diet. Please watch on your diet. You have, coffee or tea, whatever you want. I am not a dentist who's going to restrict you from having any of your foods which you want, but try to gargle out, try to swish out. Water like अच्छे से rinse out कर लीजिए. I think most of the problems will be sorted once you start rinsing out. Okay, take some time after having your food, after having chai, coffee, anything. Take some more time and just rinse it out. Okay, or it will be much better if you can brush out twice or thrice daily. That will be much, much better. Okay. And then is you're keeping your mask fresh and clean. Dampened mask, please discard them. Don't keep them with you. Just throw them out. Okay. Use a new mouthwash when you know that it is going to be, this is where I have to throw it out. Please throw it out. So after doing all this, doctor, I've been using mouthwash, I've been brushing, I've been doing all the things, but still there is no result. Please go and visit your dentist, or you can just call out on our numbers as well. We'll be more than happy to help you. See, because we always say certain things, initial stages, when you go to the dentist, they'll be cleaning up the surfaces just by doing small fillings. Okay, the major problems can be stopped. You can, major problems like root canals or extractions, all these things can be stopped by just getting the fillings done at the right time and visiting your dentist. Okay, they'll be able to guide you much, much better. So I think that's much clear about your the mask mouth, right? You know why is it happening? I'm making I'm throwing a limelight for you because awareness always precedes the change, right? Awareness, when you're aware of the problem, that this is the problem which is going to arise with my mask, and you have the solutions with you, right? So when you know the solution, you know the problem, you have the solution. Okay, so that's the only intent of mine, to make you aware so that you don't and land up in major problems. And it is treatable. It is a simple thing which we can do, and please go for it. Nothing to worry about. Okay. Next is for the pregnant women out here. I think the Baby Chakra app, the pregnant women, I would like to congratulate all the women who are pregnant. You are blessed with a soul inside your body and inside your, tummy, or you're having a blessed soul, right? So small problems might be coming up. We have pregnant women coming out with the pregnancy tumor. So मैंने डॉक्टर ने ट्यूमर बोल दिया, it is nothing like a major, malignant नहीं है. It's a simple benign tumor, nothing to worry about because of the improper brushing, and there are a lot of hormonal changes taking place. Am I right, dear pregnant women? Okay, so there are a lot of, I've been in your shoes, I know what happens. Mentally, physically, there are a lot of hormonal changes taking up, right? There are bacterial, get lost in between the gums, and that's what happens. These tumors, what you do is there are two options. One is you can brush it out, and you can use a floss as I showed you in the before slide. Yeah. So this slide, you can just use a thread that is Oral-B ka ya Colgate ka mil jayega in the medical stores. You can just pick up that, just clean up in between the teeth. Okay. Once it's clean, the swelling automatically comes down. If it is not coming down, please go and visit your dentist. Okay. So we, Indian Dental Association, behalf of Indian Dental Association, we are making complete precautionary measures in our clinics to make your, the treatment, everything, we are following many precautions. For the COVID regimes, we are following so many regimes. So it is completely safe to visit your dentist at the right time, have your regular dental checkups, brush twice daily. As I told you, you can use mouthwash and floss. And along with that, rinse out your mouth. See, most of the pregnant women having this problem of vomiting in the morning. Early morning, you start vomiting. If you put the brush also, you start vomiting, right? It's okay. Take a nice deep breath, and it's okay. Let the body react. Let the body, it knows how to heal up also, right? After vomiting, what you do is, wo acidic contents ko swish out kar dena. Always try to rinse out your mouth after your any food, any meal aap khane ke baad, just try to rinse out. Okay, that way you won't have any problems. And regular dental checkups and awareness with your doctor, with your dentist, will definitely make your pregnancy, your delivery also much, much better. And I would always women, if you are having a planned pregnancy, please go and visit the dentist before kar lenge. The doctor will be able to say these are the emergency treatments which needs to be done. Get them done so you wouldn't land up in any emergency during the pregnancy time, right? So there's lot much to cover. There are many things which are there, but due to the time constraint, maybe I'm giving you the most important and trending questions as of now, which are happening, which most of our patients come and ask us, right? Next is rampant caries in children. What is rampant caries? Nowadays, we are seeing that the bachche log ka daat, they are getting decayed much faster. Parents are coming and saying, doctor, there was just one small cavity before, like one tooth was decayed. Now it has gone to all the teeth. All the teeth have become black. Okay, I'll tell you what's to be done. Again, the same again. First, I'll show you an awareness. I'm creating an awareness here. So the caries they just come up as a white spot caries lesion like this. Okay, they end up going like this. So this is the stage where you venture out to a dentist and please ask them that what can we do, doctor? They will be using fillings or fluoride varnishes to stop the caries at this right stage. Okay, but what happens after that, पीछे का दांत, आगे का दांत, सब दांत सड़ जाएंगे. So what happens? You start ending up losing those milk teeth. I do agree with most of the parents as well as my patients saying that doctor ये तो निकलने वाला है, ये तो चले जाने वाला है. These are just temporary teeth, but these temporary teeth are going to stay in your mouth for at least 6 to 8 years. The front teeth and the पीछे का दांत at least 10 to 12 years तक तो रहेगा. At least 13 years. Okay. So till then, the the kids are going to eat with the same teeth. Okay. They are going to eat and chew with the same teeth. So please, my dear parents, please take good care of these teeth because these are the ones, the permanent teeth are coming from, they are inside, right? This infection shouldn't go and create a problem with the permanent teeth. Create a right awareness. Go and visit your dentist. They'll be happy to help you with these right brushing techniques. Sikha dena. Once they know about the techniques, they'll start brushing. We have kids, parents coming down to us and they say that, doctor, abhi meko bolne ki zarurat hi nahi pad raha hai. She's just waking up and she's doing the brushing in the night as well. She's doing the, nicely she's brushing, she's keeping up her brush properly and she's maintaining her teeth, oral hygiene and everything very, very well. It is just because right knowledge makes them, and these kids are very, very intelligent, I'm saying you. What happens is, बच्चे लोग का दांत जब भी एक साइड से सड़ जाते हैं ना, they start having cavities and all. They don't complain at all. So क्या हो जाता है? Because they are very smart enough, they shift the eating from the other side. So they don't complain. So parents say, डॉक्टर अभी तक कभी complain ही नहीं किया, कभी दांत उसको दर्द ही नहीं किया, but तब तक there is already cavity there, right? So please, mothers, make sure that there are any cavities. Please go and visit your dentist and get them filled up. Okay? So left side and right side दोनों दांत सड़ जाते हैं, and I would urge all the parents to go and visit your dentist and take a right care at the initial stages itself. All right? I hope it's clear right now till here. We have dealt with our we have dealt with the mask month. Okay, I have told you simple solutions where you can get rid or you can stop the mask mouth syndrome. Okay, second is for the pregnant females, and third is for the kids. Okay, so the kids dental treatments are very, very painless. There's nothing to worry about them because they don't know anything. Okay, so I would like to tell one more thing about the kids dental problems क्यों हो रहा है. Aajkal, many parents say that, because they have started watching TV doctor, they are watching a phone, and they're keeping the bolus of the mouth for longer time in their mouth, right? So क्या हो रहा है? So because of the food is get there longer time, so there's a lot of bacterial accumulation. So there's a lot of cavities, right? So maybe you would have seen earlier, हमारे दादाजी and all these people, they used to have foods at the regular time. 9 baje breakfast, 12 baje lunch, and then after that they'll be having their dinner, right? So it's okay to have the meals in between also, but try to say that uh, because of lot of activity in the mouth, lot of acids are acids are produced, bacterial activity is also increased. So now what to do, doctor? I'll tell you two simple things. So where you can, have this, tell this to your kids or just show this video to the kids. Okay. So you can have your chocolates, darlings. You can, all the kids, you can have your chocolates, but try to have it before having meal. अभी लंच खाना है उसके पहले आप चॉकलेट दे दीजिए. क्या होता है, this Kinder Joy and all these chocolates which are there, these chocolates create acids. So ये जब भी खाना खाते हैं, they switch out हो जाता है automatically. Okay? Or second thing what you can do is you can have a chocolate, but try to brush out after that. Okay, so these are the two simple things which you can say to your kid and say that, doctor has said this, and or else you can visit your own dentist as well. Every doctor would be able to help you. Say these two things. You will see that your kids 5 to 6 chocolates जो खाने वाले एक दो में आ जाएंगे because they have to brush or they'll be given food after that. Okay, और एक दो chocolates तो वैसे खा लेंगे, but the cavities also will be reduced. They'll be much aware of the problems or the dental problems also. Okay, so this is the time where you have to put the right seed, my dear parents, for the kids. Try to try to teach them the best habits at this age. Not only the brushing habits, their personality, their self-discipline, that everything. This is the time for them for you to put up the right seed. Okay, I hope I'm clear till now. Yes. So if you have any questions related to all these things till now, I'll be answering them at the end. So make sure you stay till the end and just, you have whatever the questions, I will definitely answer them. Right? So let's get into our most interesting and my favorite topic. So, how to have a perfect baby and enjoy your pregnancy, even during COVID. Right, I do understand there's a lot of chaos going outside. We are missing out our loved ones. We are having health issues along with so many physical and mental problems inside during the pregnancy. There's a lot of things which are going on outside. How do you say, doctor, that I can enjoy my pregnancy? I can say this because I've been in your shoes and I was a mother myself. Okay. So there was a time when my doctor said that I can never become pregnant and IVF was the only solution for me. So I'll tell you how did I get out of it and what are the simple things which you have to follow for making your pregnancy journey a milestone, a beautiful journey, right? And create the kids of the next generation much stronger, much healthier, much happier, and they are helping out all the people all around the world, right? So this is a formula, my dear friends. E plus R equals to O. I repeat, E is at the events which happen to you. What are the events? Like morning उठ के कोई और आपके ऊपर चिल्ला सकता है. You had a fight with your husband. You had a fight with your mother-in-law, or you had a maid didn't come down today, or you have to submit your work. You have to go to your boss. The boss is there. You have to be regular with the computer. You have the problem with your car. You have the problem with your AC. Some or the other problems are there. Do you have any control on this? Some people might come and just say that this is not possible. The only control is your response. This is R stands for your response. How do you respond in every single moment defines your outcome, my dear friends. The outcome is dependent on the response what you do. Okay. So when the doctor said that I couldn't conceive a baby, and only the thing which was IVF was the only option, and my parents, my husband, my in-laws, everybody started saying like, okay, fine, let's look out for the IVF, or okay, fine, let's do this, let's go for the other gynec. I said, no. I just went and sat with my gynec and I just said, doctor, just give me 1 month of time and I'll become pregnant. Let me see. I think that urge is there that I feel that I can become pregnant. If it is not that, definitely we'll get into the IVF. So my gynec also supported me, and she was very, very good that, she said that, okay, fine, you take your time and let's do it. So what I did was, that's when I started my journey with my guru, Mr. Sunil Parekh. So when I had it in my mind that I can become pregnant, I used to write down every single day, I'm pregnant right now, I'm pregnant right now, I'm pregnant. I don't know how. I know that the doctor has said that. I know that everybody is saying like, kya pagalpan kar rahe? But I was very much clear that I know that I've become pregnant. And I'm saying you, my dear friends, within 21 days, I was pregnant. I was pregnant with my beautiful son in my tummy, and I was like, that's my best time ever, right? Because we don't know what we know. We know we have the inner power, supreme power. God is there with us. Okay? You know how to respond, and that's the reason why the outcomes will be positive. Take an example of anything in your life. COVID hai, challenges hai, problems hai, people are dying out, people are hospitalized, people are, everything, you name it, we have it. The financial crisis, the job loss, the money loss. We are losing out of relationships, right? Many people are getting divorced, many people are losing their loved ones. But the response, I don't say that we shouldn't respond by crying out. We should be there for our loved one. We are there for our loved ones. But the response should be in a calm state. Take yourself calm, make yourself calm. Think what is right for you, and the outcome also will be right. When there are people, like-minded people, we think that we can come out of this COVID. We know that the challenges are happening. We know that the things are happening. Pregnant women, there are so many things which are happening physically as well as emotionally also. But the kids who are coming out of this situation, I'm saying you, they're very very strong, very very. The next generation kids are just going to rule out. And I want to put this seed right now, because only you and you, only pregnant women can make this happen. Only the women can make it happen, right? I want the outcome to be very very beautiful. Fear to faith. We have a lot of fear. We have chaos. मेरा बच्चा कैसे हो जाएगा, मेरा बेटा, बेटी होएगा या बेटा होएगा, how will I be able to deliver, because there are a lot of pains during the pregnancy, and there is a lot of chaos, a lot of, for 9 months you have to do that, and after that also it's a responsibility. And what is going to happen to my career after that, because we are educated, we are employed, we want to work out. All these things is taught. I don't know what is going to happen with my kid, how am I going to manage my the work, office, bacha, everything. My dear friends, take a deep breath and say, faith. Have a complete faith on the divine. He who has given you this knows how to make you this. Keep a complete faith on the universe, your divine, the God, the ancestors, whomever you believe in. Please have the complete faith and just go ahead and just say that, yes, do it. Yes, there is a solution. Yes, there's always a solution for all our problems. And I'm going to do it. Okay? From fear to faith, when you move out, you see people coming on, you see people coming and helping you out. The problems which are there, are they're going to vanish out, because we have 100% faith that we are going to come out of it, right? I'll tell you one more situation. When they said this, as like you, I too had the same problem. The delivery as a nightmare. I used to call all of everybody, and I used to say like, abhi delivery pains kaise hoega? Is it going to be long time, or how is the pain going to be there? So one of my cousins suggested that, and I spoke to my gynec also. They said that, the pains will be there for 1 minute for all the women. Please listen to this. The pain is going to go high in 1 minute में एक बार ऊपर जाएगा, and again it's going to come down. It's going to be for the same thing for 1 minute. It's going to be upper, very high pitch, very high pain, and take it. It's okay for 1 minute. I'll tell you why do you have to take it also for 1 minute. And during that 1 minute also, your gynec will definitely help you, because that's what my gynec also did. And she has helped me and said that nitrous oxide sedation, inhalation sedation was given to me. So I took it, and it was fine. Within 2 to 3 hours, my baby was out. It was just the intention. I wanted to have a normal delivery. I said this to my doctor, and she has helped me out. Why is this doctor, or Dr. Mahalaksshmi, is about saying about normal delivery when C-sections, cesareans are quite very good? Or I know that the C-section, there's latest technology which is available, but the natural procedures, so bacche aate hai, there are two major hormones are released because of the lot of pain, right? The hormones are secreted. The oxytocin hormone karke, it's a wonderful hormone. It's a love hormone. It's a happiness hormone. You see, after delivering a baby, the mothers will be very happy, crying out, tears aa jate. That a sense of content, a sense of happiness, sense of love towards your baby, right? So that is a love and the bonding which you have. And I'm saying you, my dear friends, this is the hormone which is going to prevent you from postpartum depressions. ये जो depression, ये जो, the chaos which is happening after the delivery, nothing is going to be. Your bond with your baby is going to be awesome. Second, There's a microbiome, that's a bacterium which is released during this pregnancy. And what happens is, ye bacterium is a protective bacterium. And this is going to protect your kid. It's going to make you immune to all the illnesses, name it. Their resistance power is going to be much, much, much better. Okay? And their respiratory, the lungs, the body, entire lungs, the entire body is going to function very, very good. You must be knowing a butterfly, right? It comes, it gets crushed up, it gets, it gets crumpled up inside the cocoon, but when it comes out, it just starts flying. The same thing. Let it go naturally. Have a faith of having a, you can give birth to a wonderful baby, and you can have a normal delivery. So I would say this is a vision board. I'll introduce this to it. Few people would have known this before also, and I'll throw a limelight on this. I didn't have this vision board during my pregnancy time, but I would like to tell this to all the pregnant women and also the people who want to become pregnant. This is the one stop, solution, or you can just have it. Okay? The vision board में क्या करते हैं? You can take up a cardboard, and what you can do is you just post the pictures of your family. You can have the babies very happily waiting for you, nicely connected. You're trusting your body that your body is going to give me a wonderful baby. It's peaceful, happy, healthily waiting for you, and very, very positive, very contented. You're giving a natural feed to a baby. You're giving your natural, the baby is completely healthy inside you and is very happily coming to you, right? So these are the pictures. You can just post the pictures. You can get whatever pictures you want. Take it from the Google. Just put it. This just place the pictures and see them day in and day out. Nothing to do. This will just take 10 to 15 minutes, my dear friends. Not more than that, right? क्या हाँ है try करो आप try करके देखो. We have seen parents who are putting twins ka pictures and they have the twins. Okay, put the pictures of healthy baby, happy baby, disciplined, very much proud. And I had this in my mind for my son. It makes me proud wherever I go. And I've seen this every place where I go. They say this, what a son, what a babe, what a boy, what kya khila ke usko ye kiya hai. It is not khila ke, it is with the mind power I have done this. I've made I wanted him to be like that. Okay, you can post a picture of next prime minister, next Sachin Tendulkar, next Modi ji, or next Indrani Nui, next Sena Nehwal, or Mother Teresa, whomever the role models you think of, please put the pictures and see them. Mother and father, both of you, if you see collaboratively, the effect will be much, much better. You must be seeing the kids also. आप भी बच्चे को देखेंगे तो उनका the facial features also, you'll be related to somewhere, maternal side या paternal side. So जिनके साथ आप ज़्यादा time बिताते हैं ना, उनके जैसे उनका शक्ल भी आ जाता है. Okay, so the kids listens, takes takes the audios, everything, they know that. And once you have the picture of this beautiful picture of a mother holding your baby in your hand, a beautiful baby whom you are giving to this soul, right? This is it. This is a happy ending for any mother. Gives you a contentment. It gives you a sense of achievement, and this is definitely going to help you. It's not only for my dear parents, my dear friends. We do have visions for our goals, for our health, for our relationships, for our for major important things which we want to achieve, right? We have the pictures of them, right? The mind always sees with the visions or the pictures. So when you have this vision of a happy baby, a normal delivery, a healthy relation with your husband, with your family, with your entire family, you're calm and confident in all the situation for this 9 months. You're having excellent diet, and you're being very, very happy with your body. And you just see this. You're having a very happy time with your babies as well, right? Post the pictures whichever you want. Your son to be next Sachin Tendulkar, or next you want to excel in the academics. Put the pictures of cup ke saath, yeah, first rank topper ke saath, or you can put the pictures of being disciplined, very obedient son, or your child which is there. It's a blessing. She's a blessing for you. Put the pictures. Go wild and go put the pictures. and see the amazing results. And see these results. And I want you, everybody, to do this. All the parents out here, you will enjoy this. You will enjoy making it, first of all. And after this, there are so many vision boards, or, excuse me, it's not only the vision boards, right? You can have visions for your baby, visions for your life, your goals, whatever you want to accomplish, or vision for the husband. Okay, the you want to search for a life partner, right? Put up the pictures of life partner, having a nice time, having a dinner with them, or having a marriage and everything. Okay, or vision board after, okay, fine doctor, मेरा तो normal हो गया, fine, you can still make the vision board. Okay, I'm saying you, it's never late. After having the vision board, after having the delivery also, you can have your baby's pictures and having a nice time with them. Or pregnant female जिनको pregnancy नहीं हो रहा है, try this. And maybe next time when I have time, I'll definitely try to put up the vision board. I'll show you how to select the pictures for becoming pregnant also. And similarly for a working woman, how do you get back to your work and maintain that work life balance, right? For everything. Everything can be managed. My dear friends, I've been doing it. If I can do it, and you can also do it. It's not only me, and every woman who knows the mind power, who knows the techniques and technology, the strategies, we can definitely do it. And I bless you, and I have my wishes and prayers for all the mothers out here. A wonderful journey of your pregnancy, and have give birth to the next generation kids who are much stronger, much happier, much healthier, and blessed souls, right? And God has chosen you to take this opportunity to become the best mother and best parent and best, uh, you know, uh, you can just become the best version of yourself as well, right? So that ends my session, and thank you so much for this opportunity. And Baby Chakra app, and all my well wishers, all my friends, family, and all my colleagues, I suppose, everybody, and all the people, whoever known and unknown. I've I've tried to add much of the value, and definitely I'll try to continue sharing more of my knowledge. And I've seen people having addictions also during pregnancy also, a little bit of emotional turmoil, so maybe we'll be covering them in the next session. Okay, so how to frame out your vision boards, or vision for becoming pregnant. Okay, how do you become pregnant also? I'll tell you simple things, all natural procedures, and then we will definitely make this world. I want to get you into this and make this world. Only mothers can do it. Only and only pregnant mother has that vision of giving birth to wonderful babies, and that's what Iqbal, आपको भी पता है, the cricketer, she used to have the vision of the crickets, and she always used to watch cricket. Same thing with, Abhimanyu, or his mother trained him for the fights and everything, and that was trained for them. Similarly, for all the, if you see the legends, everybody has a vision in their life, and that was done by a mother. The seed which was sown was very, very strong. The seed which is sown is definitely very strong, and the baby which is coming out of it is definitely very strong, right? So I would urge all the mothers out here, just imagine if we start sowing the seeds of next legends today. Okay, you just imagine what will the world become. Okay, so it will be the best place to live in, right? So thank you so much. I would end my session with that, and to be continued. Stay tuned. You can just connect with us through the Facebook, Insta, and FB, as well as YouTube. And if you have any doubts, any queries, please stay in touch with us. And thank you so much. I think we can stop at sharing. We can get back to the main screen. So can you just open up the screen for me? I cannot see the screen so that I can answer your questions. All right. So can you can zinc there are many questions here. Dental emergency during the COVID-19. Okay. So if you have any emergencies, like you have any problems with the swellings or any extractions, definitely if it's an emergency, we can be treated even during the COVID-19. So during COVID-19, we follow the protocols, right? So along with taking a consent from your gynac, we can definitely go ahead with extractions as well as root canal treatments and give you an emergency immediate relief as well for the pregnant women. And I think for the kids also, we can go ahead, we can proceed with your dental procedures because we have been following all the protocols for your dental treatments. And what constitutes an emergency during dental COVID-19? Should I go to the dentist during the COVID-19 outbreak? Yes, definitely. I would say for your regular dental visits, you can postpone. And for emergency situations, we are available. We take up our consultations because we are being all the doctors. We are doing patients on the appointment basis, right? So you can just take up an appointment. You can book your slot, come down, and only you will be treated during that time, and everything will be sanitized, and all the treatments will be done under extreme care for you, so nothing to worry about it. So if there is heavy emergency, I would say definitely try to maybe for the aged people or people who are struck with the COVID, try to take some medication and avoid a little bit. Okay, but if it is unbearable, please visit your dentist. It is absolutely safe, nothing to worry as such. What oral COVID-19 symptoms should be aware of? Okay, as I told you, first one is your mask mouth, as I first explained you. That's what has been a day in and day out. We are seeing it. The mask under say cavities and all these things are increasing, right? COVID-19 symptoms, apart from that, there is something called as mucormycosis. Okay, so where the gums as well as the bone is also getting decayed at the highest level. So ये जो symptoms जो है, the higher level से जाने के पहले, you can just start doing the initial ones, which I told you, the first one which I told you, what initial जब भी gingivitis, जब gum problem हो रहा है, please come and have your checkups done. Or what you can do is have a regular X-ray or scanning as well done. So that will sort out your problems. Okay? Can good oral hygiene prevent COVID-19? I wouldn't say that COVID-19 can be prevented by oral hygiene, but yes, taken the point that oral hygiene maintenance would definitely try to reduce your COVID-19 symptoms. Taking good mouthwash and gargling out and all these things, whichever I have explained before, definitely will be an additive factor in reducing your symptoms of COVID-19. For sure, you will be able to relieve and come out of it much faster rather than landing up in emergency situations. All right. So I hope that was fruitful, the things which have been asked. So I've been covering all the things. Can zinc kill COVID? Can zinc kill COVID? Fine. As you all know, COVID is already a virus, right? So the virus, if it is there inside your body, definitely it has to finish the cycle and it has to go, right? So I am, the zinc kills COVID. If it is a process, you can have the medication as well, which includes your zinc as well as multivitamins during the treatment course. So you can use that and you can definitely get relieved of your COVID-19 symptoms, right? And I think I have answered the questions. And there was one more, what are dentists doing to uh, prevent COVID-19? Fine. So what are we doing is we are trying to create awareness. Okay, so apart from awareness, when the patient is here with us, so we know that the person is, a little bit highly immunosuppressant patient, maybe a cancer patient or some other immunosuppressant patients. We will definitely try to postpone their treatments by giving them suitable medications and give them the right treatment at the particular time. Or all the doctors, all the dentists are we are giving presentations at different platforms, so that it is okay to have dental problems with so much of panic. It's okay to have dental problems. We do understand with medications, with the proper treatments, definitely it can be treated, and nothing to worry about your dental problems. We are there to help you in any situations. Please visit your dentist. I know most of the people out here will be having their family dentist. You can just call them. They are available on call, right? You talk to them, right? They know that what is good for you. And dental treatments, dental problems के साथ आपका, they will give you the proper procedure, proper protocol also to manage. We give our patients we give a proper armamentarium like head mask or face mask, and then leg pads. All these things are given to the patients so that they are safe during the procedures, and we make sure that the environment is also safe for the treatments, right, for our patients. And your dentist knows much better. You can just call them also. They'll be able to help you out. What are dentists doing to prevent COVID? What are oral symptoms? I think it's all answered. So I hope you had a much insightful session today. And for any other questions or answers, I'll definitely be happy to help you. Thank you so much. Namaste.